So here's Maddie, now age 7, whose school photos always give us the giggles, and whom we referred at age 3 to early intervention. He was given extensive evaluations by a developmental psychologist, a speech-language pathologist, and an occupational therapist. And all these evaluations through early intervention or through the schools are at no cost to families. The results confirmed the patterns of delays that we observed in our screening. Maddie's parents decided to enroll him in Head Start with special education support, including speech language and occupational therapy. His problems with short attention span and his tendency to misbehave, surely as a consequence of really not being well understood when he spoke, his misbehavior improved enormously when his expressive language and articulation skills improved, and with exposure to well-behaved peers whom he watched carefully and imitated. Although Maddie made great strides, his cognitive and self-help, indeed all his skills, progressed slowly relative to his peers. As we say in our clinic, development develops, and developmental problems do too. So, eventually Maddie received a diagnosis of mild intellectual disabilities as well as a speech-language impairment. Once enrolled in the public schools, he was placed in a part-time special education classroom with regular education for the rest of the day, typically during times where the activities were non-academic in nature. Meanwhile, Maddie has many vocational gifts, and he remembers without prompting to feed the animals on his parents' farm. He actually enjoys weeding the family garden, and he likes to wash dishes. So our clinic staff all went to hire him one day. So our clinic firmly believes that the earliest possible intervention is optimal. Although it isn't always a cure, it clearly helps our patients and their families. We recognize that determining which children need services definitely depends on quality early detection tools. We've also found that some of our patients didn't qualify for early intervention. At first that frustrated us, and then we learned that such children are behind, but just not behind enough to qualify, at least not yet. But we know such children are at risk for falling further and further behind with time. So we want to prevent that whenever we can so that they don't become increasingly delayed and thus need early intervention or special education services. So we rummaged around for other services when children didn't qualify, like parent training, Head Start, early Head Start, quality preschool, and daycare programs. We found lots and lots of services out there to help our patients. We've also gotten to know and appreciate the non-medical provider community, and we've worked with them to streamline the referral process and make it easier for families to make appointments and to give us feedback along the way. Some families do need extra time to follow through, and sometimes we have to repeat our message, but that eventually works. Obviously, monitoring our referrals and our patients' progress is also essential. We really like the ease, speed, and scope of PEDS Online. We have eliminated from our age-specific encounter forms our milestones checklist, even though it was drawn from the Denver 2, because that was time-consuming and it seemed to miss many children. And we found that by using PEDS Online early, and preferably before the encounter, that we have actually eliminated most of those pestiferous, oh by the way, concerns that so disrupted visit length and patient flow throughout our clinic. We found that PEDS Online shaves several minutes from our well visit encounters, time that we now spend on more worthwhile pursuits like preventing learning problems via developmental promotion, giving parents information about child rearing and discipline, encouraging parents via Reach Out and Read to share books and talk with their children during meals, and in facilitating referrals when needed. Finally, we have garnered much better reimbursement for screening from both private payers and Medicare as a consequence of using the validated tools within PEDS Online and from billing coding advice the site provides. We also asked our clinic coordinator to help figure out the various billing procedures for each of our payers to make sure that we complied with the varying requirements. Next, we discovered that those families who are usually not that great at bringing their kids in for preventive service visits, the parents we most want to reach because they have limited education and resources, are now 6 times more likely to return for well visits at our clinics. They've learned that we will address their concerns, and we already know that most of their concerns are about learning and behavior. So we use PEDS Online at all well visits starting at 6 months or earlier if parents raise concerns, or if we anticipate problems such as prematurity, if there are established conditions or syndromes. And then we continue to use PEDS Online for preventive care encounters up to 8 years of age. So here's a little back of the book information. This slide shows you the administrative panel for PEDS Online, where you can log in and see all your records. From this page, we can select to search our screens, show the most recent, and so forth. This feature gives us much flexibility in terms of managing our time and visit length. And because our clinic is doing a quality improvement initiative, we can also track our progress at routine developmental behavioral screening and developmental promotion. Here, we've selected to see our most recent screens, and the red E to the left, if we click on that, enables us to open a record and make corrections. For example, we've sometimes made mistakes with birth dates or the spelling of a patient's name, so now we can fix that easily. And also, our clinic sometimes sends families home with the MChat and has them return within a month, so we can then add that result to the screening record on the same child. The left-hand menu on the administration panel shows some of the helpful features and information about PEDS Online. These include frequently asked questions, and there's also an online brief guide. This is downloadable, and it offers information about the types of results you receive. We print it out and keep copies at every station in our clinic. We filled out the Getting Started section so that all involved remember how and where to log in with our clinic's account and its unique administration panel.